Right, well, we'll kick off as it's 2 o'clock, and actually I think we're going to have a really full conversation this afternoon, so I'm going to be conscious of time as we're going along. But just to introduce myself, for those of you who don't know me, I'm Tanya Fosdick. I'm Research Director at Agilysys. This afternoon's webinar is part of a series that we're doing as part of the Joining the Dots conference, where we help to support the RSGB's Analysts Network. So these sessions really allow us to delve more deeply into some of the topics raised at the conference and actually allow us to have further conversations with you all. So we're planning to deliver quite a few more content like this over the year. For today's session, which is on evaluation, I'm joined by Elizabeth Fox, who's Research Director of the RAC Foundation, and Faye Cannon, who's Partnership Coordinator for Warwickshire Road Safety Partnership. So what we're going to do is have a bit of a chat about some of the challenges and opportunities related to evaluating road safety interventions, and really want to hear from you as part of that conversation. So please feel free to add questions into the chat, and hopefully we'll have the time to get through them all. So I think really without further ado, what we're going to start with is a bit of a recap from Liz on what we're talking about when it comes to evaluations and specifically related to road safety. So if you are able to share your screen, Liz, fingers crossed the tech works.
Yes,
I'm going to hand over to you. Hand over to you to start the session off.
Lovely, thank you very much, Tanya. And yes, I was one of those people that hadn't experienced Teams problems this week, but knew a lot of people that had. So it was bound to be my turn before the weekends, for the Easter weekend, but it lasted for most of the week. This up. So hopefully you should see my screen now. So I was just going to do a very quick talk through kind of intervention evaluation, kind of give a bit of a brief introduction and kind of what do we mean by it, just to help sort of kickstart our discussions really. So over the next couple of minutes, I'm really going to talk to you about, why do we do evaluation? Why is it important? What is it? And also what guidelines and support is out there for people to help support your move through evaluation, to help understand more about it and actually how to deliver it in practice. So it's just very, very brief intro just to get our discussion started. Always nice to have a look around for some quotes. This one I think was from the 16th century actually. What if we are investing in solutions that don't work? And I think that's really, really important that we have that in mind when we think about why do we do evaluation. We really need to understand, even if we've designed our interventions to the inch of their life, we really do need to understand if they're actually having the effects we expect them to have. So it's kind of key for that. But why else should we do it? I mean, these are all things I think wherever you're working in your organisations, whoever's holding the purse strings is going to want to know, is what you're delivering, is it actually effective? Is it value for money? Could I be spending that money on something else that would have better outcomes for the public? Does it, and as a result, I think it's really key that evaluation informs decision making as a result. So is it this or is it something else we deliver? It also ensures that we're all accountable for what we're doing and provides that background and information. And I think this is a key thing that I don't think as a sector we're very good at doing at the moment, which is that continuous improvement. Nothing is ever the end outcome. We're always looking to iterate and improve on what we're doing. And without doing the evaluation, we don't know which direction we can necessarily turn to. Key, I think, particularly in the sector that we work within, is nobody's working on their own. We're all working with other stakeholders. And I think increasingly people are going to be finding that stakeholders should be asking the question, well, how do we know this works? What evidence do you have? Because I really need to understand this if we're going to put our limited resources into what we're actually delivering. And, key, I think, is making sure that we can generate that knowledge and learning and share that amongst each other. And ultimately, we really want some really great interventions, multiple different great interventions that we can scale and replicate and not all be reinventing the same wheel, because, again, that's not very good use of funding, and particularly public funding, which is what most of us are working with. And another interesting thing to think about, I think, so not all changes lead to improvements, but all improvements require changes. So how do we measure the difference? And I think that is, again, a really important thing to bear in mind when we think about the importance of evaluation. We need to know which direction we move within. So obviously evaluation is a process, and it differs slightly by different published guidelines that you can look at. And here's one variation that you could consider in terms of what are the stages of evaluation. So to start with, we really need to define aims and objectives. Everybody knows this. This is key. If you're going into a classroom environment, you know, often teachers have to put up on the board what your learning outcomes and learning objectives from what you're actually delivering now. We need to do this much more clearly in what we're delivering. So aims is about what is that vision, and the objectives is about kind of how are you actually going to deliver that. So once you've kind of been very clear on your aims and objectives, then it's about establishing those outcome measures. So are we looking to have a change in behaviour, a change in knowledge, a change in skills? We often say, well, we want to reduce collisions, injuries or fatalities, but it's very difficult to get outcome measures that can actually help you assess that very successfully. So sometimes you need these interim measures to really understand, well, if we get a change in attitudes, if we've worked that through some behavioural models, we can understand how that could influence the end outcome that we're all interested in. And, you know, this is key as part of that is putting together that evaluation framework. And we talk a lot about logic models. I expect we'll talk about that in the discussion today. But really all that is setting out very clearly, what are you inputting into this? What do you expect to be your immediate outcomes? What are the longer term outcomes? And where do we expect it to go in the future? Just so you can work that through and actually measure that over time. So key also is determining the sort of type of evaluation that you're actually going to be delivering. And we know that there's various different types, isn't there? There's pre and post evaluations. There's comparison evaluations if you can't get a control group, but you need a group that's as similar as you possibly can. Or you can go for a full randomised controlled trial, which is obviously the sort of gold standard for being able to take out all of that variability and really understand is what you're delivering, what's actually having the impact. And so once you've chosen that evaluation design, you need to then obviously collect the data. And what's really key here is you make sure that that data that you're collecting is sensitive. So these measures that we're putting in place, are they, if they're self-report measures, can we actually say, well, that is actually testing what we're hoping it will test? Is it specific enough so you know exactly what you're looking at? And is it feasible? You know, we can't have all these great measures if there's actually no way of collecting the data. Obviously, increasingly, we want to try and get as much objective data as we can. So not just about what people's thoughts and feelings are and things, but also kind of that objective data, are behaviours changing, because that's going to be much more robust than relying on people's attitudes and intentions, which kind of gives us something, but is not ideal. You know, ideally we want that really robust information. So then it's kind of going on to collecting that data in the best way, analysing it and reporting it. So obviously there's various different analytical techniques you can use. If you've collected qualitative data, you can do content analysis. If it's more complex data, you'll be doing some statistical analysis to understand, is there a real difference between these groups? Hopefully you've given a group that has got the intervention and a group that hasn't. And then I think key to all of this is actually having the reporting. And I'm sure we're going to have a big discussion on this today in terms of the importance of reporting regardless of the outcome. It's really important that we all start to say this worked, this didn't, so that others can build on that and develop it, because otherwise we are not getting as far as we potentially could. So in terms of guidelines and support, I think really what I wanted to illustrate here is none of this is new. I mean, that first guidance document there from the DFT, that was from 2004, looking at how do you evaluate road safety educational interventions. And actually looking back at it, it's a really good document, and again, a really good reference document to look at. So we've been trying to do this well for a long time. I think there has been improvements overall as a sector, but we still need to push it that bit further. So I just wanted to highlight some other really useful reports that are out there. One that we published at the RAC Foundation by Dr. Fiona Filan, I think has been really helpful for many working in the sector, because it talks about how to use behaviour change techniques in your work, and also it has a section on there about evaluation as well. We shouldn't forget the HM Treasury Green Book that talks about evaluation and appraisal, really important for those particularly working in government. And obviously the Behavioural Insights team, they always have very useful documents, and this one in particular looks at how do you develop and run those behavioural insight projects. So plenty of resources out there for you all to go and look at, but you know, sometimes it can feel a bit overwhelming. So I guess part of today will be about how can we shortcut some of these things and make it as easy as possible, to make it as tenable as possible, to do that as possible. Okay, so I think that's all I had really, Tanya, really was in way of introduction. The report I've just got on the screen there, that's one that I published last year. It was based on my PhD research, particularly around young driver safety, if anybody's interested in that particular area, and kind of working through the things that we should look at doing as part of intervention design, which obviously includes evaluation. So I thought that might be relevant to mention there. So I'll just stop sharing my screen, and hopefully that's given us a good start.
Definitely. Thank you, Liz. And I'm sure we'll touch on your research specifically as we go through the conversation. But I think what we want to do now is kind of ask the audience a little bit. So, Steve, if you're able to launch the Menti screens. Now, I know looking down some of the names, not all of you are practitioners, so we'll see kind of what proportion of you will be able to participate in this. But the first question, if we can click onto this, and you should just be able to interact with it within Teams itself, is to let us know on a scale of 0 to 100%, what percentage of your interventions do you evaluate? So you should be able to just move the slider along and press submit. And obviously, if you don't evaluate, if you're not involved, then you can skip this particular question. But let's see. Oh, this is lovely. I haven't seen this scale move like this before as people are adding their responses. I do like an interactive Mentimeter.
Hopefully everybody can see it, Tanya. I certainly can't see it at the moment, but I think that's probably just my screen. So hopefully it's not just, hopefully it's just me.
And I've seen, yeah, I can see Anne has got the same problem. Can anybody else not see it? We can. So Andrew says it's working for him. So I think this is these Teams gremlins that we potentially had at the beginning. Let's see how many responses have we got. A tiny number there, but I think it says 21 or 29. Contact lenses are a little bit tight, but yeah, and it seems to have stopped moving. So and Brian says it's working for him. So fingers crossed, it's all good. So for those of you who can't see it, we've got here an average of 61.7% is what people have said. So yeah, 62% of interventions are evaluated, which is really interesting. Okay, let's move on to the next question. So what percentage of those interventions which are evaluated are externally evaluated? So not necessarily undertaken by those within the team, but you kind of bring in academics or evaluation partners to help you with those evaluations. And I see Steve's added the link, so hopefully you'll be able to get to Menti via that link if you can't access it directly through Teams. Again, that seems to have come to a little bit of a full stop. So the response we've got here is 22.5, just dropped down a bit, 22.5% externally. Yeah, so about a quarter externally evaluated. Okay, and then just onto the final question for you all is what proportion of your overall costs for an intervention do you allocate to evaluating the project? So we've put these into bands. So when you're thinking about your budget, do you allocate nothing? Do you allocate 1 to 10%, 11 to 20%, or more than 20%? About 20 people participating, so let's see if there's any more. But the majority by far are looking at kind of allocating 1 to 10% of their budget to evaluating. Okay, we will come back to you some more in some specific questions, but what I'd like to do is have a chat with Liz and with Faye about those results. So Faye, I'm going to come to you first and put you on the spot a little bit. So how might you have answered those questions in terms of percentage you evaluate and kind of external support that you get?
Yeah, so thinking about kind of evaluation on a whole, we were thinking kind of roughly that 70 to 80%. We try and do some kind of evaluation on everything we do, even if it's kind of at that real basic level, like Liz was speaking about, those aims and objectives and looking at the data and where it fits in. External evaluation, once again, really tough question. We were looking around the 40 to 50%, but that's in a range of ways. So it's using joint national evaluation, like what is being done with the older driver VR sessions through First Car, and there's some work being done on mature driver reviews, but also using interventions that have been done by universities that has already been evaluated before we started using them. So there's some change blindness work from Warwickshire University, and then we commission external evaluation on our road safety education. In Warwickshire, we really value that external evaluation. So we look to do about 10 to 15% of the budget a year on that. So that roughly is what we class as one big evaluation a year. So that's primary or secondary school programme, or some of our community programmes as well. But look for other options through the partnership or Road Safety Trust.
Wonderful, thank you. So just kind of going back to the first question about the proportion of interventions which are evaluated. So you've got a pretty high percent there. You said kind of 80%, which is brilliant. What are the barriers to getting to 100? Do you think you would ever be able to evaluate 100% of your interventions, or would you want to?
Yeah, I think there's kind of three big barriers for us. So the first one, like probably with everyone, is the cost. We've got some digital resources that we give out in schools, and they're really hard to evaluate anyway, and it would cost a lot of money to do. So it's prioritising those ones that are in person and can have that external evaluation. Speaking to officers as well, it's that time. So we very much, evaluation is from the beginning of a programme when it's being developed. So it's the time it takes to get that external evaluator on board, coordinating those calendars, those introductory meetings around aims and objectives, but also reviewing the questionnaires, getting them out into, for instance, schools. We're really passionate, and it can sometimes feel like that gets in the way of being able to deliver because you really want to get going, but we know that the evaluation is key and it needs to be involved from day one. And then finally is participation. We can really struggle with getting schools involved, but also participants. So we did some work with our active travel workplace programme, and just for kind of comparison, we got 66 questionnaires pre and then only 20 post. Interviews 5 pre, 1 post. So it really is hard to keep that engagement throughout.
That's really useful. Liz, I suppose coming to you, does all of that sound familiar to you in terms of some of these practical barriers that people are encountering when trying to evaluate their road safety interventions?
Yes, sadly, so it's very familiar. So you're not on your own there, Faye. From what I've seen that others have said have been challenging, and the work that I've done over the past few years as well. I was interested on the polls with the sort of the 1 to 10% of evaluation being the highest amount. I wonder whether difficult, because the difference between 1 and 10% is quite large, isn't it? So 10% is kind of the recommended for what people should put aside for evaluation. So I wonder whether that was kind of what people were saying in that, or actually whether it was not very much at all. But obviously, clearly, resource is an issue. And as you said, Faye, the kind of getting pre and post and getting enough of the sample at the beginning so that at the end you can match people through and you've got enough is really challenging. And I do wonder, this is really why I think we need to do better at developing resources with the kind of input up front and evaluation up front, so that we can have national level resources that people can then roll out with the confidence that they have been evaluated. Of course, we're going to have to go back and check they're still delivering what they need to do and iterate them over time. But otherwise, we're all doing that kind of really hard evaluation right at the beginning, which it needs to be really robust and it's really challenging to do. So I think particularly of what you said, it was the response rates, which is really challenging, let alone then relating that through to, well, if you're going to do a statistical analysis of this, how many responses do you need to be able to get a reliable response given what you're measuring? So that becomes really, really challenging, doesn't it? So yeah, it is difficult out there, but it's great that we're all trying to do it a little bit more and we're all trying to improve and learn from each other. I think that's vitally important.
Absolutely. And I think we'll probably come on to some of those opportunities and how we might kind of get the economies of scale by working more closely together, because I think rather than kind of individual areas experiencing the pain of evaluating something quite similar and struggling with sample sizes, actually if we could collaborate more, I think, and Faye, you're obviously tapping into national evaluations, but more of that would really be beneficial. I've got a question from Brian, and I think it kind of links. I've got two questions actually, one from me and one from Brian. But let's start with Brian's. Would you ever abandon an intervention when you realise that you can't evaluate it, or it would involve a disproportionate cost to evaluate, whether it's successful or not? Now, obviously, if you haven't evaluated it, we don't know if it's successful or not. But we've got a hunch that it's something good, but we can't evaluate it. Would we be willing to abandon it? Go for it, Liz.
Yeah, I think my initial response to that, fantastic question, and really good to kind of, pose that sort of challenge or dilemma that lots of us will kind of be facing. I would say it depends on what's gone into the intervention in the first place. So if your intervention has been designed using aims and objectives, using behavioural theory and psychology, and it's got a logic model, and you have an idea of actually what you're delivering and how it's supposed to influence things, that would be, if we look at the sort of NICE guidance in terms of how to evaluate programmes, that's kind of what they consider level 1. And I think that, there's a huge amount around ethics here, isn't there, about the ethics of delivery and whether you can be sure that you're having a desirable impact or not. Providing you had an intention to evaluate it at a point, I think there is a point where you can say, yes, okay, there's enough that's gone into the front end of this that we can be confident that we know what it's trying to deliver, but we do need to have that evaluation at some point. But it's a really sticky, difficult question, but that would be my initial response, is as long as you've got enough that's feeding in, then that you might have a little bit of grace potentially before evaluating.
Fabulous.
Don't know what your thoughts are on that, Faye.
I was going to say, Faye.
Yeah, I'd agree. So I think one thing that I was going to bring up further down the line, but this kind of makes sense, is we did a lot of work with that with our digital resources, and then the skills that our officers have learned from doing evaluation. They've put some kind of evaluation into our digital resource just to understand a change in perception or beliefs through surveys. So while that isn't the best evaluation, that's not what we'd want, it gives us an idea. So yeah, further down the line we'd look to evaluate, but even now we've got an idea that it's changing that beliefs. So this one is around crossing the road for kind of primary school, and if they would think about crossing then. So we see a change through that session that they would then not be crossing at more risky locations.
Yeah, I think that's a really interesting point, Faye, because there are different measures that you'd use depending on how mature an intervention is. So earlier on, you might want to get an understanding, is this changing knowledge, which we know doesn't necessarily lead for you to change in behaviour, but knowledge is important, or beliefs are important to inform future things. Is it changing attitudes? And that might give you an early indication of whether things are going in the right direction before you start to get into the nitty gritty of really evaluating, does it affect intentions, does it affect behaviours, etc. So you could do some questions that give you that sense of whether things are going in the right or the wrong direction. And the other thing which you mentioned there is the importance of almost piloting, actually having, even if you're doing it on a really small scale, just to understand if there are any things that you weren't expecting. That might be a good way of getting started, and to make sure you're still kind of thinking about ethical delivery, I suppose.
Great, thank you. I'm going to come back to ethical delivery in a moment, but Sam has asked, we know that often when practitioners come to evaluate their interventions and programmes, the needs, problem analyses and setting out measurable objectives are not carried out in the initial stages of an evaluation. So often only after an intervention has been selected. We have a lot, as Faye said, we've got a lot of passionate people who are really keen to make a difference, but we don't necessarily go back and set those aims objectives. So how important is it to carry out these actions early on, given that there is a key balance between adhering to best practice versus realistic levels of activity based on available resource? Faye, I'm going to come to you first because you are on the front line there.
Yeah, we see this a lot, like you say. We have a lot of passion and people have an idea of an intervention that they think will fit the mould or fit what we're trying to solve. We do a lot around that aims and objectives, that problem solving. So in the partnership, we work a lot with the problem solving team at Warwickshire Police, and that is collecting all the data we can to understand the problem, to look at the root cause, so your intervention can relate to what you're looking to change. So one of the things we're looking at is garage anxiety, so understanding what people are anxious about and why they're not getting the maintenance done on their vehicles. So really deep level analysis first, so you can really have specific aims and objectives. So I see it as really important, and we push for that through the partnership, and being accountable. So while sometimes our interventions take longer to get going, we know it's based on the right things to begin with. So yeah, we're lucky management understand that as well and push that forward.
Oh, that's music to my ears. Yeah, Liz, any thoughts on that?
Well, just when you read out that question, the whole idea of retrospective evaluation, I think lots of us that worked in that space have been asked to do that or come across that quite a lot, and trying to say, okay, we're looking at this intervention, what do we think the aims and objectives were, and therefore can we measure it on that? And obviously that's not ideal, and I'd like to see going forwards, as we move forward as a sector, that we will be able, even if somebody hasn't done the evaluation themselves, they'll be able to say, these are the clear aims and objectives, this is what we were aiming to influence, can you evaluate it for us? Because then it makes it, it should make it a lot of a simpler process, because then you can go, well, it's very clear that here we want to understand, can we affect people's feelings of control about, and yes, you were saying about garage anxiety, like people's feelings of control, that they can go and assertively ask the right questions or feel like they can come away with the right information. If you're very clear about what you're trying to achieve, it should be much easier to evaluate. So I think it will demystify it a lot, actually, for people once we can get into that position of getting that logic model in place and saying what we want to actually influence, and then evaluating it should be the natural next consequence. You've kind of done the hard work up front, actually, by working out what you want to do.
Brilliant, thank you. And a moment ago you talked about kind of the ethics of delivery, and I think this is super important. I mean, what do we see as the greatest challenges of not evaluating our interventions? I mean, I've got a couple of thoughts, but I'm sure both of you have got some real strong opinions on what happens if we don't do these things. Who wants to start?
Happy to. So for us, it goes back to that lovely saying of causing no harm, and if you don't evaluate, you don't know. So at a local level for us, it's so important to know that impact and what it's having on people. For ourselves, with our road safety education, as a partnership, we have a number of partners who might want to deliver in schools, but we can be really robust and say, road safety education team are delivering this programme because it's been evaluated. We know it has the effect we want it to have. And that's really worked over the last couple of years. It's kind of given the reasons why our partners don't just go in, give a talk or whatever they feel like would be right. We know what we're delivering is right, and it's really helped streamline and know that they're getting the right interventions at the right time that's age appropriate as well. So it's so important for us to be able to then say why we're doing this and the reasons why this is the right way.
And do you have any examples of evaluations where actually the results weren't as you expected and it's changed practice as a consequence?
Yeah, so for primary schools, they did a review of all what we did from kind of year 1 to year 6, and it was year 6 that we saw it was having no change in intentions or attitudes. So we went away and reviewed the lesson and changed the aims and objectives and looked at what the focus was on. So that changed to impulse control. So now that's being re-evaluated to see if it works. And once again, we're quite open. If it doesn't work, then we'll look again and see what needs changing around that. So that was a really good example of where the evaluation showed it wasn't quite working. The style was okay because it was working throughout everywhere else, but it was what the focus was on wasn't working for year 6.
It's really interesting. And Liz, obviously this is something that you know an awful lot about from your doctoral research. This is kind of the foundation really of understanding when things don't quite work as planned. I mean, over to you on this one.
Yeah, I mean, I think you're 100% right, Faye. It's the kind of the do no harm bit that has to be the kind of key reason why we must keep on doing this, because a lot of the work we do is not intuitive. You know, people will think, well, surely that will have that outcome, and quite unusually sometimes they just don't have the outcomes you expect. I mean, one of the key ones that I think, particularly in our field, that's particularly relevant is you know, advanced driver training, particularly for new drivers, giving them skid pan training. You know, the automatic reaction there is to think, well, surely we're giving them key skills that they're going to use, and then when they find themselves in these situations, they're going to be able to use them. And what you find is that might be the case if they then went into a skid the week afterwards, because they've immediately got that knowledge that's ingrained. But we know that there's skill fade, and over time that they're not going to be able to recall what they need to do in those emergency situations. But what you have done in the process is you've increased their confidence. They feel that they can cope with those scenarios, and therefore they were more likely to speed or do things that would cause them to have those situations and not be able to deal with them. So often it's counterintuitive. I think the work that I've been doing, particularly on testimonial theatre work, is also counterintuitive, and we constantly get the feedback from teachers and deliverers that this must work. We see the impact this has on people. You know, we sit there, we can see that they're attentive, they're listening, they're emotionally effective. How on earth could this not affect their behaviours? And it's kind of counterintuitive, isn't it? You think it would, but unfortunately we know from not only the research in this field, but the research in other areas of public health that that's just not how we work as humans. You know, particularly for young males in particular, they're more likely to dismiss the message, think that they're better than everybody else, that this applies to people, not them, and that's just a product of the way that they're more likely to think, particularly those impulsive individuals that you really want to have an effect on. So yeah, I think that poses a huge number of challenges, and it's not just in our area, it's in all areas of public health. And there's some fascinating examples elsewhere, like, you know, the Scared Straight programs of taking juvenile delinquents into jails to prove to them how awful it is being in jail, and then they find out that actually increases their likelihood of being in jail than if they'd actually not done those programs in the first place. So yeah, we need to really test our assumptions and make sure that they're in line with what we understand from the research.
Definitely. And in fact, Andrew has echoed what you've said there. So they found evaluation results from the target audience sometimes are very different to the gut feeling of those delivering the intervention and or other observers, for example, teachers. So teachers don't think it works, but the students show it does. We have an example of that from several years ago where it was a young driver programme. And I think the importance of this example is actually the right evaluation as well. So there were pre and post questionnaires, a lot of it to do with knowledge and attitudes, which showed that there were small changes as a result of the intervention. But we ended up using the prototype willingness model and really trying to unpick what these youngsters were thinking at the beginning of the day versus the end. It's quite a hard-hitting presentation, talked a lot about risky behaviours and kind of illegal behaviours. And what we found was at the beginning of the day, their knowledge was really good, their attitudes were very positive, and they were very averse to these behaviours. But because they'd had a 6-hour session really reinforcing how at risk they were and how at risk they were of engaging in these behaviours, when we talked to them at the end of the day, they'd pretty much normalised behaviour. And it almost felt like it was a bit of an inevitability that they were going to behave in that way. We would have never expected that result, and certainly we couldn't have gleaned it from just doing the surveys of, you know, how do you feel about this, that and the other in terms of attitudes and intentions. So the right design is super important here as well, isn't it? Right, I'm just I've had another question from Nathan before we move on, and I think it's related to the challenge and probably my next question. But one challenge I often have is knowing how applicable an evaluation result is, e.g. intervention X is 20% effective in location Y, is to other settings. So can we talk about some of the considerations with sharing results and applying them elsewhere? And I think this is one of my big passions, is about sharing results. So yeah, how do we make make findings applicable and transferable? What kind of plane, I suppose, in the way that we present the findings, so that somebody can pick them up and understand the conditions in which that it is likely to apply in their area. Liz, I'm going to come to you first.
Yeah, no, that's a really important question, because if you were kind of following a nice model of kind of evaluation, you would start out with working out what you want to do, then you collect a bit of data, and then what you do next is you get a control group in your area and work out if that's having an effect. And then the sort of stages above that are like, well, given it's had this effect here, can we replicate that other places? So almost testing that out and then finding out if that is true and then rolling out more broadly. So that's the kind of formal way in which you should look at rollout. It's a very staged process, and you'd want to sort of check that all the way through. The other thing I'd say is important is just making sure as part of the evaluation process that you're collecting that social demographic data, so that you can say this was delivered to this particular demographic, and therefore if you were to deliver it to a completely different demographic, we couldn't say it would have the same results. I mean, geographical areas are interesting, because obviously, particularly where we are working it, you've got different road networks, you've got different challenges that people face. But I think a lot of the other things are pretty common amongst road users, apart from the road network they're on. So really, you want to understand about their age profile, their kind of even income levels, that sort of thing, that really kind of affects how different interventions land with different target groups. I think there's sort of, you know, this mosaic acorn profiling stuff is much more important to understand who you're delivering to, because, you know, clearly if you're delivering to older versus younger drivers, you're going to need a completely different intervention. So I would say demographics is kind of the key thing there.
Wonderful. Faye, do you have anything to add on?
Yeah, I just think from a kind of practitioner point of view, so for us, whatever's been evaluated, we're really confident in sharing. That gives us that, but we always also say, come and watch us deliver that presentation or that intervention, so you can see how it's been evaluated and used in Warwickshire, so you can see if it would work in your area as well. So we're kind of keen that we're more than happy to share and give, but if you come and watch, you'll understand how it's being presented as well, and that, like you say, the demographics, the ages, etc.
Yeah, and I think that point about understanding how something has been delivered. So, you know, sometimes when you look at research articles, it will say a nurse delivered something, but you don't know who the nurse was, how they delivered it, or how much time they took. And that really matters, doesn't it, in terms of kind of the dose that you're giving, how it's presented, the framing of it. And so I guess as you start to roll things out, and maybe you're doing this phase, really providing those detailed lesson plans so that somebody else can pick it up and go, okay, I've got a sense of this. But even better if they can come and observe what you're doing and say, okay, well, this is how it's delivered here, this is how I've got to deliver it elsewhere. So it's not just what you're delivering, but how you're delivering it, as you say, is vitally important, because you can get massive differences just in the way that things are delivered.
Definitely. So do we kind of see some sort of standardization of almost evaluation reports being useful, so that it kind of sets out the justification in the first place, thinking about the behavioural models and the logic models which lead to the aims and objectives, and then almost a manual of delivery. If you're going to pick this up and deliver it in your area, this is what you will need to do to achieve similar results to us. I mean, I'm guessing that's something with, you know, from the DriveFit programme, it kind of comes with a guidance of how you ought to be delivering it.
Yeah, that's right. I think that's really important as people look to kind of roll things out. And I was just thinking, as you were saying that, Tanya, I've looked at quite a lot of international studies and trying to compare different results from different programs, and they all measure things in different ways. And I think somebody much cleverer than I has managed to work out some sort of meta-analysis approach where you can compare different types of even statistical results with each other so that they're more comparable. But just thinking on that level, that's not done yet. So it's very difficult to understand how something in one part of the country might differ to something in the other part, because we're measuring them in different ways. So I think, as you said, Tanya, I think it's really important that we, as a collective, it would be great to have some consistent ways of measuring these things so that we can do a bit more comparison and say, well, actually, is that down to where it's been delivered rather than just down to how it's measured? I think that's going to be really important to do.
Definitely. And I suppose we've also got, related to all of this, is the thorny subject of publication, and we're probably all aware of evaluations which haven't seen the light of day. How do we overcome that? How do we, and perhaps this is one for you, Faye, is how do we break down this kind of stigma of being judged in your intervention that you're super passionate about, and you probably put a lot of effort into designing and delivering, and then the results may not be as glowing as one expected? Potentially, how do we kind of overcome this issue of not sharing? Because I think it is still a problem within our sector.
Yeah, I think so. I think for us, we try and support that as much as we can. I am a huge advocate. I'm waiting for us to do something wrong so I can shout it from the rooftops.
Brilliant.
So I can be that, and hopefully then lead by example. But also, I was speaking to some of the other officers. It's also time being able to promote what we've done, even the positive evaluation. We get into with time is such a resource that, yeah, we get our evaluation, we get really we're happy with what's come out, but then we don't share it. I think sometimes it's knowing where to share, but also the time it takes to share and publicise it as well. So I think as a sector, yeah, we do need to get better at sharing both positive but also negative. So like for us, we did a campaign around speeding. It was related to COM-B and money, and thinking about putting money down the drain because of speeding, and we put it on petrol pumps because that seemed the correct location when they'd be thinking about it. And we did some really internal evaluation of it and more just to see if people even noticed it, and we saw nothing. It was really low numbers even saw the campaign. So it's things like that. How do we share to say this isn't work, this didn't work, and where we could share it? And also it's down to, once again, we didn't do external evaluation, so someone came back to me and said it could have just been nudge theory. They might have seen it and just not seen it at that point. Why it might have been how you also method of the evaluation at that time. So yeah, still a lot of work to do around sharing, I think.
Thank you. Liz, any thoughts?
Yeah, no, I agree on that front. I think it's a cultural issue in our sector, but I don't think we should beat ourselves up. I think this is, you see even in academic publications, don't often see a publication that says this didn't work. It just doesn't seem to be in the interest of the authors to do that. So I think we're working in a whole system which doesn't support that. But as you both said, the greatest learning comes from actually stuff that doesn't work rather than stuff that does. So I'm really pleased that we've got funding to iterate the Dry Fit programme. So Road Safety Trust has provided some funding to do some iteration work, and as part of that, I've commissioned a SWOT analysis of the existing programme from an educational specialist, because we didn't have that kind of input in early on. And I'll read out some of the weaknesses for you as part of this this process. So because other people will learn from it. So what they said in terms of weaknesses, it lacked a robust educational practice, and particularly in alignment to PSHE principles, which I think is something we should all be thinking about when we're going into schools and making sure we've got that input. They suggested the police involvement and presentational style could lead to mixed messaging and discomfort for the audience, which was quite interesting, because that where that was included was to kind of demonstrate some kind of enforcement consequences. You know, we know that's a BCT, but that was interesting that for PSHE angle, they kind of thought that wasn't quite right. There were some assumptions made of target audience views to undermine the credibility and effectiveness of the messaging. So they essentially said that, and almost we did it purposely to kind of, for the presenter to make questions that the public would ask of experts potentially, but completely right that we'd made some assumptions there that could have led to, as you said, Tanya, kind of pigeonholing the target audience in a way that they shouldn't be pigeonholed. So I thought that was an interesting observation. And clearly lack of diversity and accessibility in video, which limits reach and inclusivity. And I think we've all got a long way to go with, you know, making sure that we are genuinely inclusive in what we're delivering. And interestingly, even though this was designed to be a positively framed intervention, there was still the comment that some content may be traumatizing without warning, which was not what I was expecting. And that was referred to, there were some crash test dummies that we used. And obviously we always think that you're taking one step removed from, you know, an actual person being involved, but taking it from a sort of trauma informed approach, that was questioned as well. So there you go, there's some learning that we're getting from current kind of work that's going on, and keen to kind of feed that into the process as well.
That's amazing. And that does really take us onto some of the opportunities, I think, that as we move forward. So I think the involvement of kind of educational specialists there, should we be looking outside of the kind of the road safety sector to get more insight from other domains to help us with evaluating? How do we feel about kind of drawing? Yeah, working with educationalists, working with people in the health sector, I think that brings a different perspective that perhaps we haven't considered before. Who else might we talk to, and what other benefits do we think we might get from doing that?
Yeah, for myself, even though it's probably moving away from that evaluation, we're looking around doing a needs assessment to understand drink and drug drivers, kind of offenders, their needs and their support, and taking it from that kind of health angle and getting our health and our support service providers on board and understanding their lives, because it's very much with the addiction that driving is just a thing they do, when we very much think about it is they drive and they drink. So we're really hoping for some really good insights and results, so then that can help with some interventions around reducing drink and drug driving in Warwickshire, because we'll understand it even further. So I definitely agree, bringing in different practices into road safety is really useful.
Wonderful, and that will shape your aims and objectives, and therefore how you evaluate those interventions. So yeah, that's wonderful. Any extra thoughts from you, Liz, on that one?
Yeah, I mean, I always think bringing in as many different people with different expertise is better, because none of us can do everything, can we? So it's ideal to do that. I think the educational bit is a clear missing link, although I know that lots of people come into the road safety sector from education, and maybe we should be making better use of that pool, because there is that group kind of out there. I think the other thing we can do better, so in a traditional research sense, you design something, you go out and test it with a target audience, you do focus groups to inform that, etc., etc. Whereas there's obviously a much more huge focus now on co-design, which I think from a research sense, there's kind of a bit of a, whoa, what actually, how does that work? Because they might suggest something that you wouldn't even recommend. But I've seen some work that's been done, thinking particularly the SOMO work on their seatbelt campaign using co-design, which is really interesting. I think starts to develop that idea and approach a bit further. I think we need to do more to understand how the kind of two worlds come together. I'm quite keen as part of Drive Fit to do not only just minimal viable product testing as part of the redesign, but also do a bit of co-design if we can, to make sure that it lands right. We need the right messaging, we need to have the right input and content, but we also need to make sure that it's right for that target audience. So I think more that we can involve people that we are trying to speak to, rather than just making those assumptions, which we will do. I think that's important to do.
Definitely. And thinking about the Drive Fit experience, I suppose one question for you is, have you seen any changes in the sector from working through Drive Fit? I'm thinking about some of the work that we've done through the Road Safety Trust, and actually we've seen quite a change in language and openness amongst partners whilst we've gone through a really kind of rigorous evaluation process. I think it kind of changes the way in which people look at their work. So have you seen, kind of through involvement in evaluations, any opportunities kind of to change the way in which we work? And I'll come back to Faye in a moment, but start with you, Liz.
Yeah, that's really interesting, because the work that I did as part of my PhD was just an extension of work that many other people have done over 10, 20 years beforehand. We can think of the likes of people who remember Frank McKenna and doing work on all different interventions. So all of that work has been there for a long time, saying we need to change what we're doing. I think what I was quite fortunate with the work I did was that it was able to really engage with delivery partners, and it was almost a co-design in a way with delivery partners, which I think often researchers and universities just don't have the opportunity to do in the same sense, just because of the direction I was coming from. So I think that's made a massive difference here, because when people are part of something and are coming along and informing that journey, then at the end of it, they're much more likely to go, well, we've learned something as part of this, we want to take it forward ourselves in what we're doing. So I think that's made a big difference. And I think there's a good lesson there for let's bring researchers and deliverers and everybody together in a true partnership to kind of work these things through, because I think that's the best way. And I think where we're seeing the change is you're getting leadership from the sector, from the likes of NFCC, you've got the DFT, you've got many different high-level partners that are saying we want to have change in this area, we want to drive it, and without that nothing happens. Research that sits on the shelf, and you know, unless anybody wants to take it up or to drive it forward, it just doesn't do anything. So I think that to me has been the big difference, is having people that are keen and interested. You're always having new people into the sector, and I think when new people come into the sector, they rightly question, well, what should we be doing, what's the latest advice? And I think maybe we're getting more of an influx of new people that are asking those questions, but it just seems that we're at a bit of a moment maybe, and yeah, it's good to hear you've had that sort of feedback as well.
Yeah, definitely. Even just the language changing, you know, people not really being used to the terminology right at the beginning of the project, and then right at the end, you know, talking about outcomes and outputs and objectives, and it's kind of, yeah, it's music to the ears. Faye, you early on spoke about managers and colleagues really buying into this. How did you achieve that as a partnership, and B, has it changed the way in which you work more generally and kind of question what you're doing?
Yeah, I think so. So the road safety education team, even before the partnership was formed in 2020, were already doing that external evaluation. So they already understood all that with around the outputs, outcomes, and what we're looking to do. So that was very much brought into the partnership, and then bringing kind of those key people on board at management level, but also kind of officer level. So we did a lot with the officers in fire who would go into schools, and we still do that now, explaining, thanks Liz's work, around why we don't do that fear tactics anymore and those testimonials, and the reasons why. And it's been really good to be able to explain that in a way that they can understand. Once again, it goes back to that feeling that it should be that way we do it. That feels like the right way to do it, but we can explain in detail why not, especially for those young people. So that's been really useful. Kind of ourselves, we've had an influx of new staff into the education team, so they've brought into the ideas and are really pushing that forward around evaluation, behaviour change techniques, and what we're looking to achieve working with aims and objectives first. We still have it, we can have a spate of collisions, or something comes, an emerging trend, and people want to make a difference there and then, and it's bringing them back and making them think, well, what is the aims and objectives, what are we going to try and achieve, so the intervention fits with it.
That's brilliant, thank you. We've got about 7 minutes left. We've got a few more questions, so I think before my final questions, I'm just going to dash down and see what we've missed in terms of what's come through from the audience. I think we've probably touched on that one. Bear with me. Maybe we've gone through them. So I suppose my kind of starting to wrap up question, and perhaps people in the audience will have some thoughts on this as well. What would we like to see in the future for the sector in terms of evaluation? What, if you had a kind of magic wand or a wish list, what would be on there in terms of what would we like to see, particularly related to evaluations? I can see Liz is jotting some notes. I'm going to come to you first, then Faye. Probably on the spot.
I was going to say, that's how she got away with that. She just pretended to write. I think one for us is around being aware of other upcoming evaluations. So we're involved in that national research into the mature driver kind of confidence booster reviews, and that's been really helpful for us, because now we help fund that, but we can understand how well they're working. So where there is that opportunity to be involved in national reviews or reviews with others to spread that cost would be really good, and learn together. So that would be my kind of wish, how we can do more partnering evaluation.
Definitely. We want to kind of avoid duplication as well, don't we? Because you know, we've got some funders out there, variety, I mean, including the RIC Foundation, but we need to make sure that we haven't got kind of DFT over there funding about something very similar to Road Safety Trust, to RICF. So yeah, I'm not quite sure of the mechanisms there, but wouldn't it be lovely if we had a kind of a catalogue to say that this is what's being done right now and when the results are expected. I think that would be a massive opportunity, and would allow people to choose to opt in, as you say, so that you're not doing it at a local level. Liz, you've taken your notes. Come on, what's
I
on your
thought I'd
wish
jot
list?
down the 3 things before I forgot them. But no, I think you're right about the catalogue, Tanya, because you know, we know in research terms, when I was doing my research, I put it on the ISRCTN registry, which is a clinical trials registry, where you register what you're doing and you provide updates on findings, and it kind of makes sure anybody that's going to do work in that area can find it out. Driver 2020 was on there as well. They can find out what the outcomes are, or they can make sure they don't repeat it, and that's the point. It's the duplication, isn't it? And I think
Definitely.
We've always wanted to have that register of what people are up to, so that we can work together or find out a bit more about what each other are doing, but it's really hard to achieve. So my 3 things I wrote down was, it'd be great if we can get this DFT guidance out. So DFT are working on some road safety education guidance, and I think that will perform a really important role of kind of setting out criteria for everybody to be working to, and it helps people then, if you have any issues locally, you can say, well, we're working to national guidance on this is kind of where we have to go. And then I think as a result of that, clearly everybody's on a journey on this front at different levels, and I think there's going to need to be support for the sector. You can't just expect change like that, or people to completely drop what they're doing and expect it to change tomorrow. It's going to be a process, and we need to somehow have some support for the sector to do that. And as I said, for evaluation, I'd love to see some question banks. I know that we do have some. I think you were talking the other day, Tanya, about DFT question banks, but they're not really road safety orientated, and being able to have some, you know, this is what we're trying to achieve and this is the way you can measure it, and then having that number of different ways would be great. I can see that Annabelle Priest has commented in the chat saying about being in touch with UFA, and Annabelle's doing some great work as part of the NFCC, trying to pull together lots of young driver interventions. So if anybody's got young driver interventions that are working on, I see Annabelle's put her email address in there, do get in touch with her and drop her a note, because she's trying to understand what's going on out there and how to pull those together and make sure that they're obviously of a quality and a standard that they can be shared. So I think there's lots of interesting packets of things that are happening at the moment, but I think we're moving in a really positive direction, actually, which is great.
Definitely, thank you. And I suppose my wish list is very similar to Faye, this whole idea of kind of collaborating between areas to be able to scale up, get those sample sizes, share the pain, share the cost, share the time, you know, all of those practical barriers that you spoke about at the beginning. If we could have a region or you know, kind of area of the country or similar, you know, schemes collaborating, I think it would really help us to achieve those sample sizes and almost have a lead authority on one, and then, you know, it isn't so much of a resource commitment. And then for me, it's that publication of findings, I think, is absolutely key, and we've really got to keep pushing for that. Wonderful. We've got 2 minutes left. Has anybody from the floor got any burning questions before we close and allow you to head off for your long weekends? I can see if we've got any typing. Nothing there at the moment, but it's great that we've already got connections coming through between different areas just from having this conversation. So that's great. Andrew, you've got in there. Yeah, we've got to keep pushing, but having been in the sector for quite some time, it does feel we are going in the right direction. I do, as you say, I think there is a bit of a movement right now, Liz. I think the language is changing. I think evaluation is seen as less scary, adversarial as perhaps it might have done. So the more we can bring academics and practitioners together with the value of evidence, the better, as far as I can see. Wonderful. Okay, well, I think that's probably a pretty good moment to wrap up. So thank you all for your time today. We hope you found the conversation interesting. Please do look out for our further webinars, which are going to be coming in the Joining the Dots series, and we hope we'll see all of you there. Thank you so much, Liz and Faye, for the conversation today. I always love chatting to you both, so this is a great session for me. And I suppose for everybody, in the meantime, have a really great long weekend. Hope there's some sunshine for some of us at some point. Thank you all very much, and we'll hopefully see you all soon.
Thanks, everyone.
Thank you.